Spencer Kobren's The Bald Truth.
So the work on the JAK inhibitors really started about 4 years ago, and you know, because we know each other a long time, that I have alopecia areata, which is why we started working on this to begin with.
Well, first of all, it's amazing. Just for those who don't understand how long Angela and I have known each other, I mean, back in 1997, when my book was sold, it was, I had finished my final draft. It was in galley form. And then I find out that Dr. Christiano basically discovered the first gene linked to hair loss. So I had to stop the presses and tell my publisher, listen, we got to get this in the book. And I called you up. You were kind enough. And, I mean, you didn't know me from Adam, and I hadn't been published yet. You were kind enough to contact me back right away. And we spoke, and I was able to get your discovery in the first Bald Truth. And I guess the rest is history. And we've known each other for 18 years.
The rest is history.
It's crazy.
And it was the first time that our work had the chance to be out into the world. So it was good for us too.
Let's get back to what you were talking about.
The reason we met is because I'm also, I suffer from alopecia myself, which I think everyone knows. I have alopecia areata. It runs in my family.
Right.
And that's really what prompted us to, get working on the genetics of hair. And it's, for the first 10 years, I guess, we're doing, one gene at a time, looking at simple forms of hair loss. And then over, maybe a course of 10 years, working with the alopecia areata registry, we had a chance to actually do some large-scale genetics and genomics. And so we did a genome-wide association study, a GWAS study, which you all know about, and it lit up some very unexpected genes. And it showed us that, unlike what we thought we would find, which was that alopecia areata would look like psoriasis or vitiligo,
right.
We were surprised to find that the genes actually overlapped with unexpected diseases like type 1 diabetes and celiac disease and rheumatoid arthritis, which was a surprise. And so,
well, it's a surprise. It's also it's a huge finding because then it kind of gives you a pathway to go in another direction.
Yeah, it was. It took us a while, a few months, to kind of reorient to what the genes were telling us, because it wasn't a way that we were, sort of expecting to go down looking at the disease. But you're right, especially because these are diseases that a lot of research has gone on, especially rheumatoid arthritis. So we were really lucky to sort of land on some pathways that the drug, development industry had already been interrogating with pharmacology, which was tremendous.
But isn't it fascinating that the two current treatments that we have today, which we've had since, the reason I wrote The Bald Truth, the reason I'm behind this mic, the reason I do what I do is because I was lucky enough to have success with finasteride before it was approved by the FDA as Propecia. And, of course, I had success with minoxidil, but nothing has really changed in all those years. So there's been a lot of frustration out there. And both of these drugs were found, in a sense, accidentally. Finasteride users who were, guys with benign prostate hyperplasia were growing hair. And people who were using minoxidil or Lonitin for high blood pressure were getting, there was hair growth as well. So that's when these pharmaceutical companies decided to focus on that.
That's
right. It's pretty amazing how, this is just the way these things work.
It was a shock to us, but you're right. It is the first time, I think, that a choice of drugs will actually have come out, at least in our case, from the genetic studies, which, again, you sort of have to suspend reality and say, let the genes tell us, where this is going to go. And it's not a class of drugs I think anybody would have predicted. So when we use them on alopecia areata, we sort of get a double whammy. We can inhibit both the T cells from attacking the hair follicle, and then this is the unexpected part. They also seem to act locally on the hair follicle itself, and that was the part that was surprising to us. So the other neat thing about them for alopecia areata is they can both reverse and prevent the disease in mice. And also now, we and a bunch of others have put series of patients on both drugs, ruxolitinib and tofacitinib. And for alopecia areata, we're getting, tremendous response rates, like 75%. So, and complete regrowth over time. For us, it was, as usual, complete serendipity because what we noticed, really what led us to go looking, when we treated the mice for alopecia areata with these JAK inhibitors, we treated them both topically and systemically. And to anybody that's used to looking at hair, if you saw them side by side, you would say, wow, those topically treated mice are really growing much faster and darker and thicker than they should be based on comparing them to the systemically treated mice.
Right.
And if you pick that up, it's sort of, and saw the pictures, next to each other, it was unmistakable. So that, again, random observation was sort of what led us to then take the whole JAK inhibitor program and move it out of alopecia areata and into just normal hair cycling.
But I mean, what's amazing about that is that it kind of eliminates a lot of the possible systemic side effects from these very powerful drugs. And even though there's going to be some, there's going to be some systemic, probably, side effects if it's used topically, it's going to be minimized. So the fact that it's more powerful, more potent topically, I mean, that's a game changer.
I think that based on what we've seen, at least, I think if there was going to be a systemic effect, it probably would have been picked up by now because so many patients are taking these drugs for arthritis.
Right.
And to my knowledge, I haven't seen any case reports or any reports anywhere, even hearsay, of patients taking Xeljanz for their arthritis who have regrown hair. So that to me speaks to the fact that we must need a local concentration. Like you were just saying for Propecia,
right.
It came up organically through patients taking it. That's not happening yet with the JAK inhibitors. And I think the reason is we must need a pretty high local concentration right in the hair follicle to get this effect. The other thing is about what you mentioned about systemic absorption. These drugs have a really short half-life. The reason they're taken twice a day is because of that. So even if there is some systemic absorption, they're not likely to be the drug won't be around in the body for a long time. And in the mice, the drug only works where we put it. It's not like the mice grow hair everywhere. Right. They only regrow where we place the drug. So
I'm listening to you, I'm getting chills.
Oh,
I'm serious. I mean, this is really exciting. You think I want to continue to do this for the rest of my life?
No.
Yeah, I'm done. I'm out of here. I'm ready to retire. I thought this was going to be over a long time ago.
I'm trying. We're working really hard.
No, but really, it is really exciting, and we've talked about the chatter online, and there's just so much misinformation out there, and I really wanted to get it directly straight from the source.
Yeah.
And even when you do interviews, when you're working and interviewing with the mainstream media, you just never know what's accurate and what's inaccurate. So I wanted to get it directly from you.
Well, good. Thank you.
Well, thank you. Come on. All right. So I'm sorry I interrupted you. So go ahead.
No, it's okay. So, I think, it's fair that we should talk about some of the, obviously a lot of things look great in mice, and by the time they get to people, nothing happens.
Right.
But I think sort of the reference case here and the compound we compared to in the paper is, you probably remember this like 10 or 12 years ago, the Curus drugs, the sonic hedgehog agonists. Sure. Remember all that excitement?
Of course, yeah.
So we used that as a benchmark, basically as a positive control in the experiments to see sort of how it would stack up against that drug. And because for a lot of people, that still is one of the only drugs that can really drive hair follicles into anagen quickly and potently. And so when we compared the JAK inhibitors to the sonic hedgehog agonists, the kinetics are really very similar. So it seems it's either hitting the same pathway downstream or sort of acting on those same early progenitor cells in the hair follicle to get them back into cycle. The thing that we didn't expect, and this was another surprise, this is probably a little too technical and not so interesting, but I'll say it anyway.
I think people are going to be interested, so go ahead.
So normally people associate active JAK signaling with cell proliferation. So it's like an accelerator. In the cells, JAK signaling is a go signal, not a stop signal.
Right.
It looks like in the hair follicle, it's the opposite. It looks like JAK signaling is actually elevated during telogen, which is counterintuitive. It's the opposite of what we see in most other systems, and that to bring the hairs out of telogen, we actually apply the inhibitor lower JAK signaling, and then that seems to allow the hairs to enter anagen. The good thing is that same model is actually now starting to creep up in some other places. It seems like muscle stem cells probably also use active JAK signaling to promote quiescence. So it's not like we're an anomaly anymore.
Wow.
But that's good. So there's some really interesting biology behind it as well that'll take us, 5 years to figure out. But in the meantime,
Well, but what I find interesting though is that this
Yeah.
is this using JAK inhibitors, like you said, you're not only just preventing the onset of the disease, but you're actually able to reverse the condition.
Yeah, so for certain in alopecia areata, it's a reverse. There's no question it can do both. When we apply to just normal telogen mice, we're getting the hairs to come right out of
Right.
telogen and go directly into anagen. The questions are many. What pathways are we hitting? Does this have anything to do with androgens? What about sonic hedgehogs? So that that the reason that those sonic hedgehog drugs were not developed was because it was later found that constitutively activating sonic hedgehog could lead to skin cancer.
Right.
And so
Tumor
that
growth,
became
right.
a concern, and it was, they were sort of never developed further despite that really exciting effect. So hopefully hitting, some of these other pathways further downstream will enable us to, try and intervene but not, turn on tumor growth pathways, hopefully.
Right. Well, yeah, I'm sorry to cut you off, but I mean,
No.
here are the questions. Obviously, I think it's if you guys are able to really help what is it now on average, 2 or 3 million Americans who are suffering with alopecia areata.
Yeah,
I
it's
mean, that would
6
be
million. Yeah. Mhm.
what is it, 6 million?
6 million.
Oh
Yeah.
my God! Wow,
Yeah,
how to
it's a
get
big number.
That's a big number. I mean,
That
that would
includes
be
kids, so yeah.
yeah, that would be amazing. That would
Mhm.
be just a miracle.
Yeah.
But I deal with, for the most part, men and women who are dealing with androgenic alopecia.
Yep.
And their question, and I mean, we're talking about thousands of emails.
Oh.
Their question to us is, A, is this going to work for people with typical AGA,
Mhm.
common male and female pattern hair loss? And another question, which I think could be a slightly, I don't want to say it's dangerous, but a lot of guys are like, if we get our hands on these drugs, can we, take them to a compounding pharmacy and try them on ourselves? And I wanted to talk to you about that because there's a lot of gray market stuff happening online that I personally feel is pretty dangerous. And there are a lot of
Okay.
people who are willing to take risks,
Yeah.
So first, let's talk about, your thoughts on androgenic alopecia. And I know that you guys are moving in that direction or going to be moving in that direction.
Investigators are not allowed to just reformulate something
Sure.
and make it into a clinical trial. We'd love to, but but we can't.
Yeah.
Our hands are a little bit tied there in terms
But
of
there are physicians though that might do something off label and
Yeah, well, the physician can on an individual patient basis.
right.
We can't make a batch of it and administer it to 20 people in a clinical trial.
Right.
But any physician can, as I understand it at least, and you know that I'm not one.
Right.
I think my understanding is any physician can have a compound made up into a topical formulation and give it to a patient. So
Well,
that's
that's
clearly happening for alopecia areata already. We know that.
Yeah, and that's my understanding as well.
Yeah, so that's possible. How much success would be likely without optimizing the delivery, I don't know, and I'm sure your listeners know how expensive these drugs are. So there's a lot of cost involved in either purchasing them or having a pharmacy compound them.
Sure.
But I do know it's going on. I've heard the same things. So, yeah.
Okay, and as far as what you guys, your thoughts on how this may work in the future for androgenic alopecia. I mean, are you hopeful? Are you really hopeful?
So I'm excited about the stem cell stimulating effect. Clearly, I mean, putting something back into anagen is thrilling,
Right.
no matter what. Whether we can keep them there is, I think, going to be a question. So once they start to regrow, if they start to regrow, do we get, for example, an effect on dermal cells that would help enhance the overall health of the follicle? And so one of the things that's in our paper that didn't really make it into the news very much, but I think your listeners might be interested.
Sure.
We actually combined the JAK inhibitors with some of our earlier work on dermal papilla spheres and induction. It's buried in the paper, but
Okay.
nobody's talking about it. But, so if
Well,
you
let's
remember
talk about it.
okay,
Yeah.
a few years ago we published a paper with Colin Yehoda and I looking at the inductive potential of dermal papilla cells,
Right.
and that when you grow them in 3D spheres, that we enhance their inductive properties, and we restore about 25% of their gene expression just by growing them in spheres. And so to sort of get at your question, we can see the effect of the JAK inhibitors on the epithelial cells, on the stem cells. That's what makes the hairs grow so quickly. But we also wanted to try and ask, were they going to do anything good to the dermal cells? So we added JAK inhibitors to our spheres, to our dermal papilla spheres.
Right.
And we showed that we get, from 25, we get about 50% restoration of an inductive signal. And they actually increase the numbers of hairs that grow when the spheres are treated with a JAK inhibitor.
Now, that to me,
So-
that's incredibly exciting. I mean, the fact that the media didn't pick up on that, like you said, is buried deep in the paper.
Yeah, it is.
But that's
It's in the
important
weeds.
stuff.
I think so, because
Yeah.
when you think about, if you're applying it locally, you're going to be hitting the epithelial cells and the dermal cells. And so we were just trying to get at, like what you said, what would be, where could this be acting? So other folks have shown that there's very nice STAT signaling in the dermal papilla, so it wasn't so surprising that it would work. But long answer to the question of, I think the drug will impact both compartments,
Right.
both the epidermal and the dermal papilla. So that, I think, is a positive. And then I think the other question will be, is this the kind of thing where you could use it for a few months and get your hairs back into cycle and then withdraw? For alopecia areata, we know that's not going to work because we know we have to keep treating. Most patients, once they stop drug, they start losing their hair within a month or two following, stopping the therapy. But it's a different disease process,
Sure.
clearly. So there's going to have to be a ton of work done. But
how, think about how they're going to be able to treat themselves. I mean, once they do, say you're able to grow back a full head of hair, it's going to be a lot more difficult to treat the condition. You're going to have to somehow get it deep within the hair.
Right.
Down to the root.
Yep. Yeah, I think delivery is going to become both a challenge and an opportunity, but having sort of, a formulation that will reach to the scalp and have an applicator that will get the drug where it needs to go. And also, you can't have these drugs just there for, 5 minutes.
Right.
They really need to be around for a while to do their job. So getting something that's, elegant enough to be for people to want to use and still do the job, I think there's going to be some room for some creative formulation.
Yeah, but that's still
these
it's
things.
still
It's a happy
incredibly
problem.
exciting. Absolutely, that's a
If it
high class
works,
problem.
It's a nice problem.
Yeah.
It's a good problem to have.
I agree, and I will tell you that I know that the guys and the women who are going to be listening to this they're already incredibly excited, but I do think it's important that you are kind of providing some reality. There's just so much misinformation, people putting their lives on hold, waiting for these treatments to, come to market. And we know that, I've been doing this for a long time. We've known each other for 18 years. And when we first started talking, we both thought that maybe it was, 5 to 10 years away.
Yeah, I remember very well. But the good thing, and the one good thing about this class of drugs is that it's a super hot area for pharmacology development right now. JAK inhibitors, there's 2 that are approved, but there's several others that are close behind.
Right.
And there's a ton of interest in them because they do hit so many pathways. So finding, once a company takes an interest in developing it, I was so encouraged that last year Kythera, took an interest in the prostaglandin technology from Penn, and
Right.
that's another one that sort of came from basic work in the hair follicle, which is great. So I hope that some company will really take a serious interest. Based on the alopecia areata response, it's clear that within the autoimmune disease community, there's been some real interest in that. So I hope that it kind of extends over. I think once it gets in the hands of people developing it topically, people will realize that, if it has efficacy beyond just alopecia areata, that would be great. And I know of others who are already thinking other forms of hair loss. So I think it's going to have a wide reach. And also, the other thing that helps us is there are many other things in dermatology that it could be used for. So psoriasis, atopic dermatitis, vitiligo even responds to a JAK inhibitor. So that kind of momentum, I think, coupled with the hair disorders, I think it's just a matter of time before we see, some serious interest, which is great because it's not going to take a lot of convincing. It's good for a drug company because even if it fails for one indication, they've got 3 or 4 backup indications that it could work for, which is always a good thing.
Oh, listen, I think it's perfect, and I agree with you 100%. Obviously, I mean it's there, and there's, like you said, there's so many different indications that these drug companies would, I mean, they'd be out of their minds not to move forward and try to go in this direction. And then for some reason it fails, like you said, there's other indications.
Yeah.
So,
and that'll do great things in derm, there's no question. So it's a terrific set of compounds for a lot of different skin diseases. So hopefully there'll be, some uptake, I hope. But the other nice thing is because, with that 5 to 10 to however many years, I think, again, since this is such an active field, there's going to be momentum. And so the fact that 2 of them are already approved, I think, is a great sign.
Okay, so you can't put this in stone, and I'm not asking you to. But do you think at this stage, now that we are where we are, now that you guys have gotten to this point, do you think that it's a possible reality that we're going to have some more effective treatments for androgenic alopecia within 5 years?
Well, yeah, I mean, if someone started today with an approved drug, if one of the approved drugs, said, I'm going to start today, in 3 years they could be through a phase 1. Almost to a phase 2. So there's no reason why an efficacy signal for a JAK inhibitor couldn't be had in the next 3 to 5 years. No question. It's just a matter of will and, someone sort of taking the lead on that. So, and it's going to be a quick go, no go. That's the other nice thing. There won't be a lot of mystery. If they work like they work in alopecia areata, it's obvious.
Right.
If they don't work, it's going to be obvious too. So it'll be a quick time to failure, which is, I don't think that's such a bad thing either. So no reason to prolong it if nothing looks like it's working. And mice are not the same as humans. We all know that.
Sure.
Lots of caveats. But It's been a long time. I think it's fair to say it has been a long time. I think really since the sonic hedgehog agonist, since I've seen anything in the literature that can turn on a hair cycle as quickly as these do. So
no, this is a big deal. This is a big deal, and I know you keep saying hopefully because this is science, and I know how slowly things move. And there's a lot of people who are online who listen to the program, who are on the message forums. They don't really have a full understanding of how this process works. It's one thing to make a discovery. It's another thing to put 2 and 2 together and realize, wait a second, this could actually work. But to get things pushed through, there's so much, so much red tape. So
many places it can get derailed too. And especially when you're reaching out from the academic side, there's like this whole valley in between us and the real world.
and there's people online who are like they're trying to create GoFundIt sites and they think that if they could fund the research, they're going to help to expedite the research. And what do you think about that?
I think in many ways I'm speaking the global we now, meaning in academia, I think you kind of have to get to the point where you feel like you've taken it as far as you can. There's not a lot else anyone in academia could really do at this point until some pharma partner came and said, we want to do this. We don't have access to drugs. We can't repurpose and retopicalize the ones that are out there. So in some ways, you sort of, I won't say stuck, but unless you're willing to sort of, quit our jobs and
right, and that's the thing. I think
do it. We're pretty much taking it as far as we can without a partner stepping in.
And I'm glad that you said that because I think that it's interesting that there are people out there who are trying to kind of spearhead these campaigns, and they want to take the bull by the horns and try to get things done to try to expedite your research and the research of others. But what you said is, I think, very clear.
I don't want to sound at all ungrateful. I mean, all of us in academia are starving, you know that, and hair is even harder to raise money for. So we're grateful for any and all support, and that's the global we, again, meaning all of us
Of
who
course.
do this kind of work. But I really think that, unless a partner steps forward who's willing to kind of, take the risk, and it's going to be a small risk. I mean, it's a couple of small phase 1 trials, right?
Right.
So that's really what I think needs to happen, because a lot of the stuff has already been done. People know how to do topical delivery. People know how to do imaging for a really good hair loss trial. Like, the mechanics are there. They just need to be put together into a really solid trial. So people should not be discouraged, I think, in any way. And remember, it's very early days. I mean, our paper only came out 6 weeks ago, right?
I know.
Don't give up yet.
And believe me, we're dealing with it. The fact, we try to get back to people, but it's just we're just we're overwhelmed.
My email, I can't keep up with it. And again, I just want to say publicly, we're so grateful for the encouragement and the kind words, and it really does keep us going when times are tough to read how moved people are by the fact that we keep working on it, and that the field's really kind of really opened up in the past few years.